some truth to that. Like everything, there's some truth. I think the statement of very painful is definitely an exaggeration. Like I said, I think the first 4 or 5 hours can be, uncomfortable, and your eyes can burn. After all, we did make a cut in your cornea, and obviously there's a lot of nerves that run through your cornea. So, making that cut can be painful. Everyone's pain threshold is slightly different. I would say 95%, maybe even higher, of our patients say that there was some discomfort. I felt some burning, felt like my eyes were extremely dry, but they wouldn't use the word pain. On the flip side, yes, there are people whose pain thresholds are slightly different, and there are, patients who probably experience a little pain. And for those people, if they know something about their bodies, we can do things to kind of help them recover without suffering. We certainly don't want anyone to go home and feel like, okay, that was the first. Maybe it was only for one day, but it was the worst one day of my life. We don't want that. So we can do things. We can make special drop concoctions and things to help you. So in the end, we want everyone to have a great post-operative experience. But I would say that on average, pain is inaccurate. Excimer lasers don't actually create heat, so they don't burn. There is a distinct smell that you may smell in the laser suite, but the excimer laser itself doesn't create any heat. It doesn't melt your cornea, so it doesn't burn the corneal surface. Now, if you mean feeling like this feeling of burning, obviously that's slightly different. It's because your eyes are dried out to some degree, and there was a small incision, or like the laser flap was made. So because of that, you can have some burning in your eyes, but the actual laser does not burn. It's a cold laser in many ways. So it doesn't actually create any heat energy. I would disagree with that. I think that currently there's still 2 ways to make a LASIK flap. One is with the femtosecond laser, and the other one is with a microkeratome blade. So there in itself, there's a major difference. And I think that wherever you are, it's important to ask with what technology you're using to make your flap. If I was talking to somebody, we're in Miami, Florida, but wherever you are in the country, I would say, ask your surgeon that, ask the center that you went to that. There are several different femtosecond laser platforms, 3 big companies that make different lasers, and they all have some subtle nuances that make one slightly better or worse than the other for a particular patient. But in general, they're all very good lasers. So I think if you go with any all laser LASIK, you're in a good category. That to me is kind of brings a smile to my face, I guess, because I think it's LASIK is the safest surgery that we do across the board of medicine. I honestly believe that statistically, LASIK is the most forgiving surgery and safest surgery that we do. So I'm not sure where that kind of gets out. Maybe sometimes if you're reading too much into kind of LASIK blogs and getting, too delving too deep into kind of comments from certain unhappy patients that had a rough experience. But if you look at from a statistical standpoint, mathematically, it has to be the safest surgery, if not one of the safest that we do across the board. Exact statistics I'm not sure of, but I think as we kind of mentioned earlier, I think that the likelihood of having some sort of corneal infection or inflammation from chronic contact use has to be cumulatively higher than anything the LASIK surgery would be. If we already say that LASIK is probably the safest surgery, and and I don't have the exact statistics, but I'm sure that when you add up 10 years of contact lens use, and if you're one of those people that has contacts you have to put in a case, adding another level of possible contamination. I can tell you this, I've spent enough time in the Bascom Palmer emergency room to know that all of the bad things can happen from contact lenses. So, there's no infallible technology. There's nothing that, that is foolproof 100%. But if I was to choose one, if I was a betting man, I would rather have LASIK surgery than 15 years of contact lenses. Great question, because I would be nervous about that if I wasn't doing it obviously every day. But we put in a device that separates your eyelids, and there's really no way you can create problems. Plus, the laser has a suction. At least the first part of the procedure where you make the flap has a suction on it, so it will keep your eye in place. So it's very challenging to blink or move unless you jump off the bed, which I've never seen happen. But I guess in theory you could, but it's very challenging to do something wrong. Remember, when it's reshaping your cornea, it's tracking your pupil. So the machine is actually, it has an eye on where your pupil is, and depending on the exact technology, the excimer laser is really incredible. So I've even had patients, unfortunately move their eyes. In the early part of our career, we thought, oh, okay, well, let's keep a close eye on it. We may need to retreat. Many times the patient comes back seeing perfectly well the next day, and you don't even have to do anything. LASIK can't lead to blindness, but LASIK could lead to an infection, theoretically, I guess, an infection. And this we don't see with the new all laser LASIK technologies as much. But, we have seen patients, who've had microkeratoma LASIK, or the blade LASIK, who come in from other countries, who have like a terrible corneal ulcer, which we have to kind of fix up. I wouldn't say they're blind, but those patients need a lot of treatment and sometimes need to have, corneal transplant and whatnot. But those are extremely rare. Can it happen? Yes. What is the statistics of that actually happening? It's almost zero. So, we talk a lot about safety of LASIK, and it's the one thing where I can confidently say it is extremely safe. The results of I would say they instantly change your corneal shape, but in order for you to actually see very well, you probably have to wait till the next morning. Because you need to let the surgery heal a little bit. However, there are several patients who are so nearsighted that when you physically fix that nearsightedness, they're already seeing way better than they were. So they're already starting, the smiles there, that they're already super happy because they saw less going in than they did coming out. But, I would say that the overwhelming majority of patients really get that wow factor the next morning. It is possible. Oftentimes, if you had cataract surgery and you haven't achieved your goals of your visual goals, we can do a LASIK touch-up to help get you there. It's possible in 10 years, 15 years from your surgery to have some sort of regression, but the reality is that the majority of the patients who've had LASIK surgery do not need glasses until they get much older and have cataracts or some other eye problem. The difference between LASIK and PRK is one creates a flap on your cornea and treats the middle of the cornea, and that's LASIK. The other is PRK, where you just peel the first layer of the cornea called the epithelium and treat the surface. So oftentimes PRK is referred to as surface ablation. One has a faster recovery period. The other has a slower recovery period. LASIK is better for certain patients and PRK is better for others. I would say no. We often tell patients to not wear contact lenses for at least 2 weeks prior to their LASIK consultation. But if for some reason 2 weeks is a lot, I would say at least 1 week for soft contact lenses. LASIK can fix farsightedness, nearsightedness, and astigmatism. And that's what makes LASIK so great. There's 2 lasers in all laser LASIK. The excimer laser, which is the laser that reshapes your cornea, you only have to be 18 years old. We often refer to that treatment as PRK, and that's why a lot of people who join the military are great candidates for that. The femtosecond laser, the flap creation laser, is approved after the age of 21. So in order to have all laser LASIK, theoretically you should be 21 years old. But there's a procedure for anyone above the age of 18. Hold off on any swimming for at least 10 to 14 days. Probably 2 weeks would be safe because you really don't want to get chlorine in your eyes or even salt water in your eyes. It could cause you to have some irritation and rub your eyes. If you wear goggles and they're extremely safe, I think one could make a small exception, but I would probably avoid any sort of water activities for at least a week or 2. You will have some Valium or some anesthesia on board, oral anesthesia, but you won't really, and you'll be in a slight twilight zone. So kind of like having a few beers or a margarita.
How long does the entire procedure take?
Total laser time for LASIK is less than 1 minute. So it's incredible. It's incredibly fast. But in our office, between checking in and checking out and going through some extra preoperative testing, you'll probably spend about 20 minutes in the office. Go back to work the next day. We've had our own surgical coordinators at your eye specialists work the day after LASIK surgery, and they saw perfectly. You don't want to get your eyes wet. For example, when you're taking a shower, you want to not rub your eyes. So anything that's going to irritate your eyes more, you should try to avoid those things. But you can get back to your regular routine and just avoid getting any sort of things in your eye and allow your eye time to heal.